We are going to move forward to step 4 of the unfolding case study, which means the fourth question you are going to see in your unfolding case study is about planning. It's about generating solutions. Now you are thinking, now you know what are the problems going on. You have a possible diagnosis right now in your mind with all the clients. Now you are thinking, as a competent nurse, what is something I might be doing? What should I anticipate? What is probably the plan of care for these clients? What can we do in the future to get these things corrected? Okay, that's the question is. So here is what is going on. Which planned interventions are appropriate for each client based on the findings? And just one per client, okay? One thing per client. This also can be a drag and drop. It can be drop down. So either way, just figure out what is going to be one thing you can do. What would you say? Our CHF client, right? Now we can probably name each client. This is our CHF client. What would you do? One thing I know for sure, I am not going to give IV fluids, right? He's already fluid overloaded. No. So what is the best thing I can do? Loop diuretics. Yes, we need to get that fluid out. So one thing I will do for this CHF patient who is overload is initiate loop diuretics. Very good, very good. Because diuretics are going to help with, with releasing those extra fluid. How about client B? This is our AFib client, atrial fibrillation client. What is something we can do specific, okay? Be specific. The client with AFib, what is something we will be giving to them? It's for AFib client, we will be administering anticoagulants. Now, when we talked about the ECGs and the AFib, one thing we discussed, is that atrial fibrillation, patients can go into thromboembolic events. There can be clot formations inside the heart because, it's not really compressing, it is just fibrillating. So we have to prevent that, right? So the patients will be on anticoagulants. There could be all the other medications too, okay? I mean, anticoagulants are not to treat AFib. Anticoagulants are to prevent complications which can come from AFib. To treat AFib, we may have to give other medications, but none of them are listed here. So from the available option, the only best thing which we can kind of go with is going to be anticoagulants. Yeah, and we know this AFib was not unstable. It was not high rate. It was 96. And the patient didn't have any chest pain and occasional shortness of breath with activity. So we may not be doing a lot of procedures on this patient because this patient is hemodynamically stable. Okay, so we will try to treat this AFib with medications. And then if that fails and if the patient comes back with, or something else is going to happen with more problems, then we might think about like cardioversions or something like that. But that's not going to be the first. Okay. So coming to C, client C, this is our endocarditis patient. What do we do with endocarditis? Okay, we give antibiotics. Very good. This patient is going to get IV antibiotics. Now, is that patient going to get IV fluid? Maybe IV fluid bolus? I don't know, because I don't think there was dehydrations, and it can happen with fever and sweating and stuff like that. But between IV bolus and IV antibiotics for a patient with infective endocarditis, if I can choose only one, I will go with antibiotics because that's more important. Okay, so that's why we are going to go with 2. All right, client D, this is the one with AV block. Okay, what do? We need pacemaker placement. Okay, did somebody say atropine? I mean, atropine is something we use when there is bradycardia, right? I mean, in AV block also in some cases, atropine is one of the way to go. But if you look at our cardiac lecture, we have discussed this. When there is already morbid type 2 and hemodynamically unstable, atropine is not going to be the best choice. Okay? Because atropine may make it worse and the patient may go into asystole because it's already like really bad. So the best option for this patient is going to be, we need a pacemaker for this patient. Okay, and that's why I'm not selecting atropine. I'm going to go with prepare pacemaker placement. Now, for the other cases, if it was just a sinus bradycardia or even symptomatic sinus bradycardia, I would have gone for atropine because atropine is like, when you think about the ACLS pathway, that's how we manage it. But this is not just any symptomatic bradycardia. It's a type 2 morbid too, right? So, all right. So, are we okay so far? Right? This is going to be the way we are going to generate solutions in our fourth area. Okay. Now, like I said, if you are a repeater, go back to your CPR and see where you are near or below passing standard. You have to be above passing standard in all these steps. Okay? Not even one can go down.